Welcome to another Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry, straight from the experts. It's Jan with you, and also Dr. Clifford Yudelman taking a nice deep dive into the world of dental care from a consumer's perspective. So whether you're looking to brighten your smile or just protect your wallet, we've got you covered with this podcast, giving you practical advice and also the latest insights. So stay with us as we uncover the secrets to maintaining both your dental health and also your finances. As always, a very big welcome to Dr. Clifford Yudelman. Are you well?
I'm well, thanks. How are you doing?
Very good, thank you. So today, talking about maintaining your perfect smile and tips for long-lasting veneers and bonding. What daily oral hygiene practices, doctor, are essential for maintaining your veneers and bonded teeth?
So if a veneer or bonded tooth or an injection molded composite bonding is done very well, there isn't anything special to do. You brush twice a day with a soft bristle toothbrush. You don't want to use a toothbrush that's too abrasive on your own teeth as well as on any kind of composite. Although the injection molded composite bonding, we see patients 6 and 12 and 24 months later, and they just look better and better. They don't abrade from brushing. So some of this advice changes as the materials improve. But what's important with any restoration is you want to floss daily to remove plaque and food between your teeth. You know, with injection molded composite bonding, depending on how much of the tooth surface has been covered, the tooth is fairly well protected. With veneers that are only sitting on the front of the tooth, if you get a lot of plaque buildup between the teeth, you can still get a cavity on your own tooth because the back of your tooth is all still exposed and it's your own enamel. So with that in mind, I don't think that your teeth are bulletproof. Even with a crown on a tooth, you can have plaque build up at the gum line, and the plaque can eat away at the root of the tooth, and that's disastrous, especially because with a crown, the tooth has already been drilled down quite extensively, which is the reason why we don't like crowns all that much at OptiSmile. Our preference is, as we discussed last week, injection molded composite. You know, I always recommend a fluoride toothpaste, or there's some newer toothpaste with hydroxyapatite, you know, to help prevent any kind of cavities. We tell people to avoid any very abrasive toothpaste, like a smoker's toothpaste. And yeah, we always emphasize consistent and gentle oral care. One can use whitening trays and do the occasional hydrogen peroxide treatment, which helps the gums and can clean up any stain that might build up between the teeth. But that's on an individual basis.
Any specific foods or drinks that patients should avoid to protect their veneers and bonding?
Oh, that's a great question right there. So we always used to say with bonding, you know, to avoid red wine, to obviously avoiding smoking is always a good idea from many aspects. And, you know, trying to tell someone who drinks double espressos or coffee, limit your coffee because you're going to stain your teeth. They would rather just drink coffee and have horrible teeth. So we don't tell people to avoid coffee. I mean, a lot of dentists will warn patients of all kinds of things now that they've done their veneers, because when they do come back, if there is a stain at the gum line or something, and they can say, "Oh, have you been drinking coffee? Well, I told you not to do that." And then there's no kind of warranty. But we let patients drink pretty much everything. But one thing that we're very adamant about, and that I always warn people about, is eating very hard, crusty sourdough toast. I think it's when you toast sourdough, the crust can be, it's like biting rocks. And the other one is, if you're going to eat a rusk, make sure you dunk it first. So that would be something. You know, there is general advice on the internet about avoiding sticky candies and chewing gum, but honestly, I tell people to enjoy all of that. We always recommend avoiding highly acidic foods and drinks. So the worst one is the lemon in the hot water, which we've spoken about before. That erodes the teeth. So you've got a veneer protecting the front of your teeth, but you can still get a lot of erosion on the back. The same with bonding. Look, bonding is interchangeable with composite filling. So if you've got a white filling on your front tooth and then they bonded the corner of the tooth, there's a lot more edges there that are prone to getting cavities or erosion versus a full cover with injection molding or a veneer. Yeah, the acidic foods, I would think, and especially like Coca-Cola or any other carbonated drinks, even sparkling water. I think these things we've spoken about in previous podcasts, I think if patients go back and listen about how to protect their teeth in general, that will also apply to these newer things like injection molding. Yeah, the injection molded composite bonding really makes your teeth back to how they were. In fact, much more resistant to acid and resistant to cavities than your natural teeth.
So how often should patients with veneers or bonding visit the dentist for checkups and cleanings?
So we generally recommend every 6 months for a cleaning, and unless a patient's got ongoing problems or very cavity prone. Just to say about cavity prone, we won't do veneers. I won't do veneers or injection molding in a patient who's not controlling their plaque or their diet and is very cavity prone until the cavity proneness or whatever's causing the cavities are sorted out first, because it's very important for the mouth to be clean and not to do cosmetic work if someone isn't able to look after it. So yeah, look at cleaning to remove plaque and tartar every 6 months. And a checkup with the dentist, I say every 12 months if you've had your whole mouth fixed up. There's not a lot that can happen over 6 months. Some dentists listening will cringe and say, oh, no, you have to check with me every 6 months. If there's anything very obvious, the hygienist will pick it up at the 6-month cleaning, unless it's the dentist that's cleaning. Yeah, we like to catch potential issues early to prevent damage. Look, I've got a patient coming in. She had 8 veneers done in Texas 2 years ago. And unfortunately, she saw one of my associates about a year ago because one front one just popped right off. And I don't know if she swallowed it. I can't remember what happened, but she had to get a brand new one. You know, sometimes if a patient doesn't swallow it or lose it, we can glue it on. So that's something that doesn't happen with injection molding. But basically, we needed to make a new veneer. She subsequently broke another one, which doesn't happen very often, and then now a third one. And so this, I'm not sure what happened with this, but that's the problem sometimes with veneers is they can give trouble. Injection molding, we haven't seen that. And this patient now, her dentist in America has kindly offered to pay us to replace all of her veneers, which she had done, 2 years ago. And now we have to drill all off these veneers, and there's not going to be a lot of tooth underneath, and we have to put new veneers on. So, look, you don't want to be chewing on that sourdough bread. And I think we'll talk in a minute about how to protect your veneers in a later on today.
So let's say in a case it becomes damaged or discolored. What do you do?
So you want to, if you chip or break or a veneer or it comes out, you want to try get in with a dentist right away. You don't want to try and repair it at home, although we have had patients where they've glued it in with that instant glue. What do you call that? Cyanoacrylate.
Wow.
And it actually works. I shouldn't say, but it actually works really well. And sometimes we actually can't get it back out to glue it in properly. I don't recommend it. There's a sharp edge. You can get orthodontic wax to put over the edge. The dentist can generally make a new veneer or repair a damaged veneer. If it's injection molding, it's amazing because we do get the occasional chip, or they don't come out or break too often, but someone can chip an edge if they forget, especially if they're biting their nails or they open a packet of chips with their teeth, and we keep the mold. So it's very quick, takes maybe 10, 15 minutes. We just clean up the chip, we put the mold over and we re-inject, and it bonds beautifully and we polish it up. So that's one of the advantages of injection molding over traditional veneers, like this poor lady that I have to redo all of her veneers. We at OptiSmile, we always will get our own patients in immediately, and we have a 5-year warranty on any work that we do. So when patients come to us and get injection molding or or veneers, and they're coming in regularly, and they wear protection like a bite guard or a retainer at night, and not eating the things that we've mentioned, we replace or repair them at no charge.
Doctor, just before we continue, anything what's the funniest thing that you've seen in your years of experience that people put in their mouth to keep their teeth in a case like that, except for glue? Bubblegum?
Let me have a think. What's the funniest thing I've
Sellotape?
Yeah. Okay, I'll tell you.
Yeah.
Well, it's never funny when a veneer falls out, but I have had a patient where they had these very white veneers done in America, and one of these veneers popped out, and they couldn't find it, and they used that correction liquid, like typewriter correction. I don't think people know what a typewriter is anymore. I don't even know if you can get it. But that white out, we used to call it,
yes,
painted on.
Oh my
And they
word.
painted their front tooth white. I mean, it looked ridiculous, and I'll never forget that. Yeah.
Thanks.
Yeah, but you can't laugh. I never think it's funny.
Yeah, it's
and
not
I mean,
funny.
that's like I said, that's why I love injection molding, because we've never had an injection molding, just fall out like a veneer. And we see a lot of patients coming in, either whether they had them done in Turkey or in the US or even here in Cape Town. But we do see problems with traditional type veneers that we haven't seen with injection molding.
And now let's talk about habits like teeth grinding or clenching. How do they affect veneers and bonding?
So my late dad was a dentist, and he always had good dad jokes. And he said it's okay to date a nun as long as you don't get into the habit.
Oh my word. Good one.
So that's a great question, because a lot of times when we see patients who need veneers or bonding or injection molding, it's because that they grind their teeth in the first place, and they've worn their teeth down or chipped their teeth, like we mentioned before. And in fact, some of these patients have this problem with grinding because they have what's called orthodontic entrapment, which means that the angle of their teeth is incorrect, and their bite is locked in, their jaws in an uncomfortable position, and that causes them to grind. And so if they don't get the Invisalign beforehand and get the bite corrected, they're going to keep grinding, and sometimes it becomes a habit. So those patients, we always recommend a bite guard or a night guard, a bruxism splint. They're all basically the same, but we get patients come in where they've had this problem, and a dentist has made them a soft, like a rubbery type of chewy bite guard. It's almost like a mouth guard that you buy in the shop for sports. And that's terrible, because that just increases your chewing. It might protect the teeth, but it actually causes headaches, and it messes up your jaw, and it becomes like a little chew toy, like a puppy chewing on a chew toy. The grinding can definitely, it's one of the worst things, especially for ceramic veneers. We find that one of the habits that's the worst thing, especially when we do get patients chipping injection molding, it's when they've only had their upper teeth injection molded and their lower teeth are still quite sharp and flat, and then they bite their nails, because then you've got this sharp enamel on the lower against this beautiful injection molding on the top. So nail biting is the worst habit, especially for injection molding. In fact, I'm more careful now recommending injection molding on patients. That's worse than sourdough bread. But having said that, I warn people about sourdough, and I haven't really seen much of a problem with that. But the grinding will accelerate the wear. Well, actually, we don't really see wear on materials. It's more a case of like this patient from the States. She definitely grinds her teeth, and she's wearing away the back of her teeth, and she's onto the edge of those ceramic veneers, which is why she's popping them off. And so when we replace her veneers, we will definitely make her a new protective bite guard, and hope that she sleeps with it every night. Otherwise, she may continue to have problems.
So, doctor, if you had veneers or bonding, what tips do you have for us on a regular professional cleaning?
So it's very important. So when we've done injection molded composite bonding, to be 100% honest, sometimes a hygienist or a dentist might not even see that anything's been done to the tooth. That's how good they can look. There's no joins. They look amazing. Sometimes it's on the front of the tooth, the back of the tooth. And if they use a air powder polisher, can be very abrasive, and it can actually damage the surface of the injection molding. You might not see it with the naked eye, but with a microscope, we've seen that this can cause some roughness, which we can then polish back out again. If the hygienist or dentist uses an ultrasonic scaler at the wrong angle on a regular ceramic veneer that's been glued on the front of the tooth, they can inadvertently, the vibrations can pop the veneer off. If the dentist themselves had popped your veneer off by mistake, the good thing is they can go and clean it all up and rebond it there and then if they didn't break it. But in general, it's a very good idea to get your teeth cleaned every 6 months and to make sure that it's done, professionally, that you go back to the place that did the veneers or the bonding in the first place. If you went to a high-end cosmetic dentist and had specialized treatment done, that you continue going to that type of practice to see the hygienists that are used to looking after this type of treatment, and not just to a regular general dentist that doesn't know what's even in your mouth.
And doctor, what role does diet play in the longevity of dental restorations?
Well, I think avoiding very acidic foods, the lemon, the vinegar. People have apple cider vinegar. Avoiding too many cocktails that are very acidic, like gin and tonics. Drinking lots of water. Having a balanced diet is good generally. It's part of comprehensive dental care. Your gums are always better when you're well nourished, and avoiding the very hard things that we mentioned, like make sure you dunk your rusks.
Okay. And any tips or best practices for ensuring that veneers and bonded teeth last as long as possible?
Yeah, so the main things to recap, because I think we've covered all of that, but it's using a bite guard or a night guard, bruxism splint if one has been made for you and recommended. If you lose it or the dog chews it or it's wearing out, get another one. Have your regular checkups. Don't use your teeth as tools to open packets or to take tags off clothing. If you get a new pair of socks, don't bite that little plastic thingy. Like I said just now, dunk your rusks. Don't have very crunchy, hard sourdough. And make sure you're brushing and flossing. That's the best you can do. And just enjoy your beautiful teeth. Smile, and the world will smile back.
That's it. Another edition of Save Your Money, Save Your Teeth. Big thanks to you, Dr. Yudelman, for sharing your knowledge with us. We appreciate it.
No, thank you very much, and look forward to speaking to you again next week, and have a great week.
Thank you. You too. And also just remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.